All right, let's start with the fact that the government is ramping up its efforts to tackle the Omicron surge. So the Biden administration says it will give out 400 million free N95 masks to Americans. Officials say they'll be available at local pharmacies and health centers by early next month. And yesterday, the site to order free at-home tests went live. So this is what you can do. You can go order 4 tests per household on the website covidtests.gov. They'll start getting delivered at the end of the month. It's very quick. It takes a couple of minutes, seriously, to do it. Now, while some are applauding these efforts, others are saying it's way too little, too late. Al, what do you think about this? And I also just want to include this because I know that internet equity, or inequity, I should say, is not everybody has access. There is a phone line. We don't have that number because it hasn't been released yet, but keep an ear out for when that phone line becomes live so you don't have to rely on the internet. Al, what do you think? Too little, too late?
I don't know if it's too little, too late. I think, Sam, it's to be expected. We in this country, and we get comments all the day, we are a capitalistic society. We pride ourselves on that. The way that you defeat a political opponent is you call them a socialist. That being said, we cannot then turn around and be surprised when we are not prepared as a society to deal with a public health crisis. We deal with private capital, not public. And so when we need things like masks, we didn't have companies that make them because there's no money in making masks and keeping them in a warehouse somewhere. There's no money in a lot of the things that we were doing, so we were not prepared. We did not have ventilators. We did not have beds. We were not ready like a country that wasn't primarily focused on capital. So this is what we are, and this is the return that we got. So I'm really not that surprised.
No, I agree with Al. I think when we say too little, too late, it kind of implies that there's nothing that can be done. So I do want to just put some credit into the idea that at least we are getting these tests, we are getting access to masks. We have to remember 2 years ago around this time, we were being told not to get the actual PPE grade mask because our hospitals and medical professionals were overrun and underprepared. So, you know, the conversation looks and sounds very different, but ultimately, does the conversation still need to be had? Of course, because look at the numbers of people who are still being affected and dying from COVID.
Tori?
Yeah. I gotta really applaud Al on what he said here, because in England, in the UK, Sam, they have Operation Moonshot, and that is started in April 2021. It's to get every single citizen a free test so they can test twice a week. I am very aware that the population is very different between us and the UK. But what did Al say? What's the real difference? Their public health service. And as we said, we have a private one. Well, guess what? When you have a contagious pandemic, health is public. We live with each other. So it makes for a very strong argument to really understand health should probably be more public, and people are going to call me out, and I welcome it, for a more run publicly health service when we have a contagious disease in our hands.
Yeah. And listen, I agree with you, Tori, and I'm not going to cherry pick, because I'm very glad that this administration is doing the free tests, the N95 masks. Great. Is that enough? Like, when an N95 mask, you're supposed to, according to our Dr. Coley and other healthcare experts, change out every week. When is there going to be another influx of masks? When you're out of those 4 COVID tests, which could take up one family. So when we test our family, 3 tests gone within 10, 15 minutes. So what's going to happen in 2 weeks? What's going to happen in 4 weeks? So I just hope that this new initiative isn't just like a fluff piece, like here you guys all go, because that will contain things for a couple of weeks, which is great. That helps stop the spread. That gives the hospitals a little time to breathe. But I hope that they can do this a little bit more long term so we can finally be done with this pandemic.